Welcome to our comprehensive guide on food and nutrition policy. In this video, we'll explore what food and nutrition policies are, why they matter, and how they shape the health and well-being of populations. We'll also take a closer look at the Ethiopian context, examining national strategies and frameworks. Whether you're a student, a public health professional, or simply interested in how policies impact nutrition, this video will provide you with a structured overview, practical examples, and key takeaways. Let's begin by understanding the basics of policy and its significance in the realm of food and nutrition. Policy is essentially a set of principles, decisions, and actions adopted by a government or institution to achieve specific goals and guide decision-making. In the context of food and nutrition, policies are coordinated actions designed to ensure a safe, nutritious, and sufficient food supply for all. These policies create the enabling environment necessary for effective nutrition interventions, shaping how resources are allocated and how programs are implemented. Understanding this foundation is crucial as we move forward to explore specific models and processes in policymaking. Food and nutrition problems are often structural, not just behavioral. While individual-level interventions like education and supplementation are important, they are not enough without supportive policies. Policies influence food systems, markets, health services, and social protection mechanisms. They help address the root causes of malnutrition and ensure that interventions reach those who need them most. This is why policy matters so much in the fight against malnutrition and food insecurity. There are several models used to understand how food and nutrition policies are made. The rational model is linear and evidence-based, moving from problem identification to analysis, solution, and implementation. While systematic, it can be unrealistic in political contexts. The incremental model sees policy changes as gradual, building on existing policies. It's politically feasible but can be slow to respond to urgent issues. The advocacy coalition model highlights the role of interest groups and coalitions, where evidence competes with values and power. Each model offers unique insights into the policymaking process. The policy triangle framework is widely used in nutrition policy analysis. It examines four key elements: content, context, process, and actors. Content refers to what the policy says. Context is the environment in which it operates. Process covers how the policy is developed and implemented, and actors are the individuals and organizations involved. This framework helps us understand the complexity of policymaking and the various factors that influence outcomes. The first step in the policymaking process is problem identification and agenda setting. This involves using surveillance and research data to highlight nutrition issues, advocacy to raise public awareness, and media attention to bring these problems to the forefront. By clearly defining the problem, policymakers can prioritize actions and allocate resources more effectively. Once the problem is identified, the next step is policy formulation. This stage includes conducting a situation analysis, consulting stakeholders, and synthesizing evidence. Stakeholder consultation ensures that diverse perspectives are considered, while evidence synthesis helps in designing effective and feasible policy options. This collaborative approach increases the likelihood of successful policy adoption and implementation. Policy adoption is where political decision-making comes into play. Policies are reviewed and approved by legislative or executive bodies. This step is critical because it determines whether a proposed policy becomes official and enforceable. Political will and leadership are essential at this stage to move policies from paper to practice. After adoption, the focus shifts to policy implementation. This involves allocating resources, coordinating institutions, and building capacity among stakeholders. Effective implementation requires clear roles, adequate funding, and strong institutional support. Without these, even the best designed policies may fail to achieve their intended outcomes. The final step is monitoring and evaluation. This process tracks the implementation of policies, assesses their impact, and identifies areas for improvement. Regular monitoring ensures accountability, while evaluation provides evidence for policy revision and adaptation. This cycle helps keep policies relevant and effective over time. Certain nutrition problems require urgent policy attention. These include child stunting and wasting, micronutrient deficiencies, maternal undernutrition, rising obesity and non-communicable diseases, and food insecurity. Addressing these issues at the policy level ensures that interventions are comprehensive and reach those most at risk. New challenges are emerging in the field of nutrition policy. These include the increasing consumption of ultra-processed foods, the rise of sugar-sweetened beverages, and the impact of climate change on food systems. Policymakers must stay alert to these trends and adapt strategies to address them effectively. Implementing food and nutrition policies is not without challenges. Structural barriers such as weak intersectoral coordination, limited financial resources, and capacity constraints can hinder progress. Overcoming these requires strong leadership, effective partnerships, and sustained investment. Political and institutional challenges also play a significant role. Competing priorities, limited political commitment, and gaps in policy implementation can slow down or derail progress. Building political will and ensuring accountability are crucial for successful policy outcomes. Technical challenges include limited local evidence and weak monitoring systems. Without reliable data and effective monitoring, it's difficult to assess progress or make informed decisions. Strengthening research capacity and investing in monitoring systems are essential steps for overcoming these barriers. Ethiopia has developed a robust set of legal and strategic frameworks to address food and nutrition challenges. These include the National Food and Nutrition Policy, 2018, the National Food and Nutrition Policy Strategy, 2021-2030, and the Food-Based Dietary Guidelines, 2022. Other key strategies include the Nutrition-Sensitive Agriculture Strategy, Agriculture Growth Program, SEQOTA Declaration, and the Productive Safety Net Program. These frameworks provide a comprehensive approach to improving nutrition at the national level. An enabling environment is crucial for effective policy implementation. In Ethiopia, this includes laws such as maternity leave for 120 paid days, regulations on the marketing of breast milk substitutes, salt iodization, and optional wheat and oil fortification standards. These legal measures support the broader nutrition policy framework and help ensure that interventions are sustainable and impactful. Evidence plays a central role in nutrition policy. It helps identify problems, supports advocacy efforts, and guides resource allocation. By grounding policies in solid evidence, governments can design interventions that are both effective and efficient, maximizing the impact of limited resources. Various types of evidence inform nutrition policy. These include surveillance data, program evaluations, economic analyses, and qualitative studies. Each type of evidence offers unique insights, helping policymakers understand the scope of nutrition problems and the effectiveness of different interventions. Translating evidence into policy involves several steps. Policy briefs summarize key findings, stakeholder dialogues facilitate consensus, and media engagement raises public awareness. These activities help bridge the gap between research and policy, ensuring that evidence informs real-world decisions. Multiple actors are involved in nutrition policy. These include government ministries, NGOs, UN agencies, academic institutions, the private sector, and civil society. Collaboration among these stakeholders is essential for designing, implementing, and monitoring effective policies. Nutrition policy is shaped not only by national priorities, but also by global commitments. Frameworks such as the Sustainable Development Goals, WHO Global Nutrition Targets, and the Sun Movement set international benchmarks and encourage countries to align their policies with global best practices. At the 78th World Health Assembly in 2025, WHO member states adopted a resolution to extend the global nutrition targets from 2025 to 2030. These targets aim to improve maternal, infant, and young child nutrition worldwide. Countries are encouraged to align their national policies with these global goals to accelerate progress. Aligning global commitments with national policies is essential for coherence and effectiveness. This involves harmonizing nutrition policies with broader development plans, ensuring regular reporting, and maintaining accountability. Such alignment helps maximize the impact of both national and international efforts. To summarize, policies play a critical role in shaping nutrition outcomes at scale. Evidence alone is not enough. Politics and multisectoral coordination are equally important. Ethiopia has strong policy frameworks, but faces challenges in implementation. Public health professionals have a vital role to play in advocating for and supporting effective policy action. For those interested in learning more, key resources include WHO Global Nutrition Policy Documents, the Food and Nutrition Policy of Ethiopia, the Ethiopian National Nutrition Program, and the SEQOTA Declaration. These documents provide detailed insights into policy development, implementation, and evaluation at both global and national levels. Thank you for joining us on this journey through food and nutrition policy. We hope this overview has deepened your understanding of how policies are developed, implemented, and evaluated, and why they are so important for public health. Stay curious and continue exploring the world of nutrition policy.